Step-by-step approach to the management of stroke. I'm Dr. Dinesh Chaudhari, attending consultant neurology at Indraprastha Apollo Hospital. Today we'll try to discuss what's the step-by-step approach in the management of stroke. Stroke, as we know, is the impairment of the blood flow to the cerebral circulation. It can be ischemic stroke, in which we have a formation of a clot inside the brain. The other could be hemorrhagic stroke, which is due to the rupture of a blood vessel and accumulation of the blood inside the brain. The management strategies would differ in both of them. We'll discuss the ischemic stroke. It has got primary prevention tactics, management of acute stroke, management of the chronic and long-term phase of the stroke, and the secondary prevention of stroke. So the primary prevention is basically the factors, the risk factors, they need to be nullified right before you develop a stroke. As the data suggests that 1 in 4 of us might eventually land up having a stroke in lifetime. So the primary prevention includes a good exercise routine, a good healthy diet, prevention of the risk factors like hypertension, diabetes, obesity, the dyslipidemia, that can give you a good control over your lifestyle. The next part is management of acute stroke, which is very important because every second counts. With every second, we are losing billions of neurons. So we must do everything to reach to the nearest hospital and get the treatment started as early as possible. Treatment includes IV TPA or thrombolysis, which is done within 3 hours. The second option is mechanical thrombectomy, in which a clot can be removed from the brain. The third option is, if you are late to the hospital or there are certain contraindications, blood thinners in the form of tablets and injections can be used. The long-term management rehabilitation includes physiotherapy and habits and the daily lifestyle modifications which prevent occurrence of further stroke. The role of medicines and regular follow-up with the doctor is very important to prevent having another stroke in the lifetime. Thank you.